Hi, I'm Dr. Elizabeth Dexter. I'm one of the thoracic surgeons here at Roswell Park Comprehensive Cancer Center, and what our department treats is cancers involving the lung, the esophagus, the rib cage, the middle of the chest called the mediastinum, and also diseases such as mesothelioma. People find out that they might have lung cancer in multiple ways. Some people are having an x-ray or a CT scan for another reason, such as they were in a car accident or they're having some other surgical procedure done and they get a preoperative evaluation and their physician sees a spot in their lung fields. Other people have actually symptoms which can be coughing, hoarseness, coughing up blood, or increased shortness of breath than they're used to. Then they also might seek help at a hospital or their primary care physicians and get some kind of chest x-ray or CAT scan done. And then they might have some masses or abnormalities seen in their lung fields. So if they have an imaging study like a chest x-ray or a CAT scan and they're sent to us, then we look at their studies and we decide if they might need something called a PET scan. So a PET scan is a scan that's a full body scan, and what happens is some sugar with a little bit of radioactivity gets injected into the vein, and cells that are infected or inflamed or possibly cancer will use more sugar for energy than the rest of our cells. So we can see how much sugar concentrates in the areas of concern that we saw in their x-ray or their CAT scan, and then that helps us decide whether we need to do further imaging or even more sampling of those areas to see if there might be infection or cancer cells in there. If the area in the lung that we're concerned about does show some or abnormality on the PET scan, then we would talk to them about either sampling that area by having a numbing done between their ribs and using a little needle between the ribs to access that area, or it's more in the middle of their chest, we could have them be all the way asleep and then go down their airway with a little camera on a flexible scope and use needles through that scope to sample. Nobody would be able to tell you for sure that you have lung cancer or a kind of odd infection until we actually sample some cells and look at them under the microscope, or if it's an infection, grow germs in culture. It's helpful to know whether something's cancer or not cancer, but also there are different kinds of lung cancer, different cell types, and nowadays with treatments getting more personalized, sometimes it's helpful to know the actual cell type, and then if we can get enough tissue, sometimes we actually want to do testing on those cancer cells to see if there are certain genetic mutations, because those people might be candidates for specialized treatments that are only available to people with mutations. When you find out you have a spot in the lung, it is very scary. It doesn't always mean that it's going to be a cancer. So we would like to do the correct testing in the correct order to make sure that we have the right diagnosis, and then specify if it happens to be a cancer, what cell type, and whether it has spread or not, so we can recommend the right treatment.